Hello, hello, hello. It's Amina Goodwin Fernandez, the infectious doctor here, and I am coming to you live after not doing this for at least a month, probably more. I think I had some pre-recorded videos, but I decided let me come on live today quickly before I come home. And today, what I'm going to talk about is what I'm going to do is answer the question that I have been getting almost every day for the past 1 to 2 weeks, and that is, Dr. Fernandez, do you think it's safe for them to let the children go back to school? I'm scared. I don't know. I think it's too soon. What do you think? And then the other might say, do you think the children need to take vitamins if they're going to go back to school? So there are a lot of concerned people, with children, and I can identify because I actually have a son. He's 3 years old, but he is not in school yet. My son actually never hasn't started kindergarten or anything. So thankfully for me, fortunately for me and my husband, we don't have to worry about that kind of disruption because he's just been at home this whole time. But a lot of people have experienced a lot of disruption with the children being at home and having to try to homeschool them and things like that. And now, because of all the fear regarding COVID, uh, people are afraid, like, oh, they might go to school and get COVID and come home and give it to me or give it to other family members, or they might get a severe case because they are asthmatic or have whatever medical problem. And so, a lot of fear, a lot of concern. Um, and then there's been, conflicting information. Generally speaking, I've stopped watching or listening to the news, so I'm not sure what they're putting out there these days, but I know there have been so many changes from the start of this pandemic. Do this, okay, no, do that, and there are just so many changes. So people are confused. So children and school, what do I think and what is my answer? Essentially, for children, we know it's going to be difficult for them to maintain that physical distance. We know that they're probably not going to be able to keep on masks, properly for a prolonged period of time. It's just natural. Children are spontaneous. They're impulsive, and they just like to play. They're children, right? It's like my son sometimes, he reminds me of a little puppy. They just kind of want to jump around and play and so on. And it's just natural. And I generally think you cannot fight nature. And so we cannot expect children to not want to play and tumble and share their snacks and share their drinks and so on. It's just not going to happen. So for who might think that they can potentially keep children apart in school, well, I think that would be wishful thinking. Okay. So, if we can't keep children apart, if we can't prevent them from sharing their toys and sharing their food and their drinks and their snacks and so on, then what are we going to do, right? In my opinion, the hard truth is that, there's probably going to be spread of COVID-19 in schools. It's going to happen because they are going to kind of be in close contact and spread their secretions and so on. But I do think that it looks, generally speaking, looking at the evidence that we have so far, of course, it's early. We know things can change because this is a very young pandemic. But basically, children are much, much, much less likely to have severe COVID-19. We know that. Like children, they will get infected, but many of them will be asymptomatic. They will show no symptoms at all, no signs, and they will be totally fine, recover totally fine. Of course, there will always be a few children who will, get severe cases. We have heard about this multisystem inflammatory syndrome, where some children have really, unfortunately, poor outcomes. But again, that is the vast majority. Looking at the figures of the deaths for COVID-19, it's definitely less than 3% who will die, and it might be 1%, maybe even lower when they look at all the data after some more time passes. Again, the deaths are predominantly in older persons who have multiple medical problems, but particularly in nursing home patients, those nursing home patients who are really not very mobile, not active. A lot of them mainly, bedbound, having had strokes. A lot of them with just lots of medical problems, on dialysis, not very functional. And like I said before, my theory is that the reason why nursing home patients are more likely to have such poor outcomes is because they're immobile, sedentary, and also a lot of times they don't have much of a drive to live compared to somebody who is active and has their job or their grandchildren or just like a good purpose in life. Okay, but for children, so anyway, so we're talking about the fact that the people who are who unfortunately have a higher likelihood of a poor outcome would be the older, especially nursing home resident with multiple medical problems. So coming back to children looking at the data so far are much less likely to die. Now, some parents might say, okay, yeah, the children are not going to die, but they might give it to me. And then what if I have a poor outcome? And what if, God forbid, I die? Or then I give it to my mother, which would be the child's grandmother. So, they're worried about that kind of transmission, right? And, lots of things can happen, but the fact is in life, a lot can go wrong, right? We can drive down the road and a drunken driver runs into us and, causes a massive problem, right? And then the other problems is medical problems in general. When we go for surgery and we consent to having a surgical procedure, we sign that consent to say that there are potential complications, including bleeding, which can be bleeding to death, a bad allergic reaction to the anesthetic, and you can die, or you can get a bad infection or whatever. But ultimately, any medical procedure you do always has the potential for some bad outcome, including death, right? So generally speaking, we always have the potential for bad outcome, but we weigh risks and benefits, okay? So you can't just say, oh, well, they could get infected and maybe they might not die, but they might bring it to me and I might die, but they might not get it. There's a chance they might not get it, or if they get it, it might be a very small, very mild infection. You might not end up getting it either. So you weigh the risks and benefits. For children, like now with all that's happened, we know that a lot of children are going to have already fallen behind, right? And some of them are irreversibly behind. So I think in the coming couple of decades, we might see, that impact on the generation where some of them are not going to reach the height that they would have reached if we didn't have this pandemic, because they fell so behind on their schoolwork that they just didn't get to, I guess, university or whatever it is. Okay, so you have to balance the child's education and their future potential with the small risk that there might be a bad outcome from COVID. So we know that probably, many children will get infected, but most of them are probably going to have mild to asymptomatic infection. Some of them will get infection and spread it to the parents or to other family members. But again, there's a less than 3% chance of, dying or of a very bad outcome, right? So you just weigh everything, right? If the children don't go to school, then there's homeschooling. And I think that it's a good idea to have an option. Like some people might be against taking the risk, and that's totally fine. And so you can take the homeschooling option. But there's some people who just don't have that option. Some people, both parents have to go to work. Some people might not have the facilities at home, proper internet, enough computers or devices for all their children. So some people are just not going to be able to have the children away from school, right? So in my opinion, I think you just weigh everything. I think chances are that most people will be fine, and that there's a higher chance of suffering from a lack of education. And then children now, not going to school, it's hard enough for us to be disciplined to do what we need to do. I mean, so many times maybe we get caught up on social media and we end up wasting time. If we can waste time by being on social media, imagine children, they're not in the classroom with the teacher, kind of insisting that you do this, that. So imagine how much they can fall behind because of all the other things that are enticing them at home or whatever with their friends, right? So these are things I think have to be balanced when talking about children going back to school. Ultimately, I think they would be better off going to school, very small risk of, dying or having a bad outcome. But yes, everybody's entitled to make their own decision and to have their own individual situation risk assessment, right? If children who have medical conditions obviously, like the parents should contact their specific pediatrician, because everybody's case is different. So somebody might have a particular medical condition where the pediatrician would say, you know what, no, it's too risky in this case, right? But outside of that, for a regular healthy child, they're probably going to be, and children are so resilient as well, by the way. Children are exceedingly resilient, you wouldn't imagine, right? Somebody asked me, okay, what about vitamins? You think maybe I should give my child vitamins if I'm going to send them back to school? Vitamins, I'm not like a big proponent of vitamins, because I believe that we should try to get most of our nutrients from our food, from good wholesome food. But if you know that your diet might be a little lacking, maybe the child doesn't like to eat vegetables and fruits and so on, and so they might not have the vitamins and minerals, the vitamin C, etc. So a multivitamin definitely would not hurt. I'm not sure how much good it's going to do, but I don't believe it's going to hurt the child. But just ultimately, just generally give good wholesome food as much as possible. Have children continue to be nice and active, because activity is always good for the body and immune system in general. And just try and get on with life. I'm from the Caribbean, and in the Caribbean we have different things. Like we have dengue, for example, and that's a mosquito-borne infection. And we don't say, oh well, it's rainy season, a lot of mosquitoes, so we're not going to let the children go to school because they might get dengue fever. We know that sometimes children can have poor outcomes with dengue, and probably almost every year at least one child might die in some of the Caribbean islands. Even I remember once I was living in Barbados, and a doctor's child, I think it was a teenager, they actually died of severe dengue fever. So bad things happen, but are we going to say, oh, we're not going to send our children to school during the rainy season because there are too many mosquitoes and my child might get bitten by a mosquito, get severe dengue, and die? We're not going to do that. We just kind of balance the risk of everything. And yeah, hope and pray. I mean, hope is not a strategy, but generally speaking, we just kind of expect that everything is going to be fine. And that's what we do in the world and in life. So yes, my opinion is that children should go to school. Now, some people might say, oh, but your child is 3, he's not going to school. Like, you can say that because you don't have a school-age child. If my child was school-age and he was already in school, I think I'd probably continue to have him be in school just to not disrupt the schedule that we already have. Of course, my concern would be, if he gets infected, then the whole house would have to be under quarantine, and I have to work, and, generally I wouldn't want to miss work. And I know that's the situation for a lot of people as well. If you miss work, you basically are not making any money. And so that's a real problem for people as well. But then, you don't go to work. Well, basically, you keep your child at school at home. So then that cuts into your ability to work, probably, and your productivity and earning potential, but you let them go to school, and then and that's by the way, kind of a chronic cut down in your productivity, possibly. But then you let them go to school, and maybe there's a small chance that they might get infected. And then if they get infected, yes, they stay home. The whole house has to be quarantined for about 10 to 14 days or so. And then hopefully everybody gets over it and gets back on with life. So yeah, that would be my concern. The fact that, yes, he could get infected, come home, bring it home. I wouldn't be afraid that we would, die because of severe illness, but just the fact that we would have to stay home, basically. Okay. So yes, those are my thoughts. Obviously, I know there are different opinions, and I obviously don't mind about if people disagree. Let me look at some of the comments and see what people are saying, if there's anything that people are saying. Not really. Angela, hi. I have mixed feelings about sending my child to school. I would hate for her to fall behind in school. If a child tests positive, will close contacts at home have to home isolate? Yeah, if somebody tests positive, that's one of the questions we get asked when we go to work as well. Have you been in contact with anybody in your household with COVID? And if you somebody at home, if somebody in my house, like say for example, my husband got COVID, then I would have to be at home quarantined for 14 days, because the fact is it would take potentially up to 14 days for me to get infected, to catch the infection from him, because it would be incubating in my body. And so because I might not have symptoms, you don't know who's going to have symptoms. So I might not have symptoms, but I potentially could be infectious. So that's the whole point of quarantining the whole household. And so, yeah, that could potentially be disruptive for people who really can't afford to miss work. And so those are where some decisions come in. But, if you keep your children at home, you have to make sure that somebody's watching out for them, right? So that they don't get led astray or fall behind, et cetera, et cetera. So everybody has to make an individual decision. I know some people also worrying about school buses. I heard somebody saying, a nurse was saying, they're not going to run the school bus in their area. And so she's wondering how she has to work. There's nobody to take and collect the child from school. So what are they going to do, right? So I don't know. The school buses, yeah, they're in close contact. They can probably wear the mask while they're on the bus, kind of close to each other. They're probably not going to be that close. But anyway, they could probably wear the mask. But again, you just kind of wait. Generally, symptomatic children stay home. Everybody knows. Anybody who has symptoms, anybody who's coughing, sputtering, sick in any way, fever anyway, stay at home. The people who have the symptoms, as much as we know that you can be infectious without any symptoms, the chance of you being infectious, you're more infectious at the height of symptoms, right? So when you're coughing, and sneezing and sputtering and just feeling sick and so on, you probably have much more virus to kind of spread outward, right? As opposed to when you have zero symptoms, you're not coughing, you're not sneezing, so you're not likely to be putting out that much virus out there. So that's kind of how I think about it. But anyway, we will see. This is still early days yet in this pandemic, and things will continue to change as they have been over the past several months. So that is my answer for children going to school. Yes, but everybody will make their own risk assessment and make their own decision for their household and their family. But don't forget that children can fall behind, and this can have lasting consequences for their future, and their potential earning potential and things like that. It's potentially quite serious. Well, everybody take care. Be safe, be careful, and take care of your health and whatever potential medical problems you might have. All right, bye.